being handed out. And this is just a way of testing yourself. These are the 9 diagnostic hallmark criteria for diagnosing depression that the psychiatric Bible, the DSM-5, uses to diagnose depression. And so rating yourself along those 9 symptoms over the last 2 weeks can give you an idea of where you're at, and then you can score those up. All 9 of those are added up, and on the back you have a little interpretation of that. And I would suggest, that it says 0 depression. That means you don't have a clinical diagnosis of depression. But between 4 and 6 is called minor depression or subsyndromal depression. I would suggest if you fall anywhere on those categories that you consider doing the community program. That program has been shown on multiple continents to be better than pharmaceuticals as far as its response within 8 weeks. And so, and of course it's cheaper than the pharmaceuticals as well, and more effective. Yeah, thank you very much, Case, thank you. So just rate yourself along that area, and then you can also see them out there at the table if you would like to register for the upcoming Community Depression and Anxiety Recovery Program. Our talk tonight, the first one, is about what can be better than even pharmaceuticals as far as depression and anxiety. Now, having said that, some people think, well, if you're going to come to this program, that means you can't be on pharmaceuticals. No, that's not true. You can still take pharmaceuticals and go through the Depression and Anxiety Recovery Program. They're not going to take you off of them as you come there, etc. That's something between you and your doctor that you will need to discuss. But chances are, once you get a lot better, the doctor will probably want to recommend that you wean off of those medicines because then you don't have to worry about the side effects if you're no longer in need of them. But that's something, again, that you would do between you and your doctor. So it's not an either-or approach. Sometimes it is both approaches, pharmaceuticals plus nutrition and lifestyle approaches that can produce a positive effect. One of the things that, however, has been shown to be very effective is spending time outdoors. There are several benefits of being outdoors, and one of them is fresh air. Fresh air contains negatively charged ions that have been shown to improve memory and learning and focus, reduces anxiety, improves mood, and has a positive antidepressant effect. Where do we find negative ions? Next to the ocean surf. So one of the advantages of going out there and having that ocean spray is it is producing negative ions. It may be why I think I heard a statistic that 98 or 99% of Australians live within 50 miles of an ocean. Of course, most of Australia, the land mass is not within 50 miles of an ocean. But nonetheless, being very close to moving water does have an antidepressant effect. And so even if you aren't next to an ocean, but where there's a waterfall, that will also be helpful. And after a thunderstorm, if there is an actual thunderstorm and there's lightning and thunder, you don't want to be out there during the storm. But as soon as the storm is over with, go outside and take a deep breath, and it will actually be antidepressant, that first breath of those negative ions after the storm. Also, if you're around evergreen trees, the evergreen trees that do not shed their leaves actually emit negative ions. One of the advantages of our residential depression and anxiety recovery program is that it's in a pine forest. In the foothills of the mountains, and you just breathe that that air in, and it can have some antidepressant properties. That's also one of the advantages. I imagine Australians are somewhat like Americans, but at Christmas time, you can have a Christmas tree that you put in your home. Most people just use a fake tree. No negative ions being emitted by that fake tree. But if there is actually an evergreen tree that's freshly cut, you can actually smell that positive effect when you come into the room. And so it's probably worth a little bit of the extra cost to get a live tree every year and get that antidepressant effect around December. Do you guys do that? Do you guys put up Christmas trees or no? No, that's not an Australian thing. Okay. Of course, in the Christmas occurs in the summer for you guys here, but in the wintertime, those Christmas trees in the home do produce some negative ions. Green spaces and health are also important. This was a very interesting study done in Denmark where they looked at diseases and how close people were to live green spaces just based on satellite. And they found out growing up near green spaces is associated with a 15 to 55% decreased risk of developing psychiatric illnesses in adulthood, depending on the specific illness. The green space effect is dose dependent. It's also been shown to enhance emotional intelligence, and spending at least 120 minutes a week in nature is associated with better health and well-being. So 2 hours is not a real long time, but I can tell you that many people are not spending much time outdoors. Does anyone want to guess what percent of time, at least in America, is spent indoors? And a typical person, if we average everyone together, how much time indoors versus outdoors? Yeah, 91% of people's time is indoors, and that was before COVID. So you can imagine it's gotten worse since that time, and so that's well over 9 to 1. And that ratio really should be better. One of the reasons why we're seeing a marked increase in depression is all of the indoor time that people are spending on screens. Adolescents who spend time in green spaces have reduced stress, better emotional well-being, less depression, and improved mental health. So it not only helps adults, it also helps teenagers to be outside. And there's a new abbreviation in the scientific literature called nature-based interventions, NBIs. And nature-based interventions on their own has been shown to improve depression and anxiety, improve stress control, reduce negative ruminations, improve focus, improve sleep, induce more physical exercise, and also they reduce the use of technology. I don't know if you've noticed, but when you're outside in the sun, it's kind of hard to see that screen, and you'd rather not even look at it and try to discern what's going on there. And so being outdoors has that nice effect of reducing the use of technology. One of the things outdoors that's particularly healthy is having a garden and working in that garden. Gardening has been shown to reduce depression and anxiety, reduce body mass index, increase life satisfaction, and increase your quality of life as well as your sense of self-worth. So working outdoors with your hands in 3 dimensions is indeed very beneficial. And then the Japanese have come up with a term called forest bathing that they've been studying. And it doesn't mean that, it's not like bathing in the sense of going into a bathtub. Forest bathing, what they mean by it is that you are just outside in a forest, walking in that forest. Researchers found that walking for 2 hours in a mixed natural forest environment improved tension and anxiety, depression and dejection, anger and hostility, fatigue, confusion, And additionally, forest bathing changed negative mood states to positive ones. And of course, this is beneficial. I'm actually thinking we're trying to arrange it all, but it's very good to be able to at least plan some sort of hike or walk in the forest at least once a week. And I understand you guys have a place not too far away from here called the Blue Mountains. And my son was asking some Australians who've been to America, is it worth it for an American to go to the Blue Mountains when we have the mountains like we do in America? And they assured him that it wasn't anything like the mountains in America, but it will produce the benefits of forest bathing. And why will it produce those benefits? Well, we'll get into it. Forest bathing has been shown to increase serotonin levels, and additional benefits are it lowers blood pressure in those with hypertension, improves autonomic function, so they'll have more vagal nerve variability, which is part of health, improve your immune system function, less respiratory allergies when you're doing forest bathing, improves your mood and stress, and it will also improve ADHD, attention deficit hyperactivity disorder, and just being out there also improves your sense of awe, so you're much more likely to develop a sense of gratitude and selflessness as well. So why all of those benefits of being out there in the forest? Well, there's several things playing a role, but one that's been largely neglected is the fact that these green plants are emitting oils that actually have benefits for depression and anxiety. You've heard of the term essential oils. Those are all oils that come from plant sources, from the trees, and we're actually breathing those oils in when we're out there walking in the forest. And that is a significant benefit. And there's been some nice randomized controlled trials done on these oils. One of them is Selexon. Selexon is a molecule that is found in lavender oil. It comes in a supplement called Lavella, and it's actually been tried against lorazepam, one of the leading drugs for anxiety. That also, lorazepam has a hook, and it will get you addicted. But Selexon has no hook, doesn't get you addicted, and 80 milligrams of lorazepam, 80 milligrams of Selexon is equal to about a quarter milligram of lorazepam as far as its anxiety relieving properties, but it doesn't suppress the frontal lobe. Lorazepam will. For instance, if you have test anxiety and you take lorazepam, you'll feel better about taking that test, but you'll score worse because your frontal lobe has been suppressed as far as problem solving. Studies have shown if you take Selexon before that test and you have test anxiety, you'll actually do better on the test because it alleviates the excessive test anxiety while improving your frontal lobe function, and so you're actually able to do better on the test. Bergamot is also an oil from citrus that's been shown to be beneficial in depression. Sandalwood, this is an oil that comes from wood itself, is antidepressant. Mint has antidepressant properties. And even the oil from sweet almond has antidepressant properties. In fact, when we have the residential program, massages have been shown to be beneficial for depression and anxiety, and we will have our massage therapist use a sweet almond oil as well as far as massaging that in, and it can have a nice positive effect. Pine needle extract is another essential oil that's been shown to be beneficial. And so not only those pine needles emit negative ions, the pine needle extract itself has some nice antidepressant properties. Then there's the ones that have been shown to help anxiety: yuzu, limonene, linalool acetate, and Selexon helps both depression and anxiety. Speaking of Selexon, it contains anti-anxiety relieving properties. I think I mentioned this. It does increase serotonin levels as well as extracellular brain serotonin levels. That means serotonin within the synapse itself. Smelling it helps, but it's most effective and predictable and the randomized controlled trials when taken orally. So you can take 80 milligrams of Lavella even 4 times a day. Most of the time we'll use it twice a day. We also utilize this for people that are trying to get off of benzos. When they come to our program, we will then switch them or wean off the benzos and switch them over to the Selexon, which makes it easier for them to get off the benzos. Deep breathing itself, very simple, but yet it's been shown to relax the body, oxygenate the brain for clearer thinking. Your oxygen saturation will go up just by taking deep breaths. It helps prevent respiratory infections, induces sound, sweet sleep, and also has been shown to improve the mood. Proper diaphragmatic breathing focuses on slow, deep breaths that rely on the diaphragm. And such breaths can combat a common relative of anxiety, which are rapid, shallow breaths. Maintaining good posture, taking stretch breaks often, and getting exercise whenever you can will aid proper breathing and maintain healthy lungs. There was a nice randomized controlled trial utilizing diaphragmatic breathing. It was a controlled trial for 8 weeks, and the breathing exercises were simple. No more than 1 breath every 15 seconds, or 4 breaths per minute, and you would do this for 15 minutes a day, just 3 days a week. And of course, the only way you can breathe 4 times a minute and not get short of breath is to breathe deeply. And so that's using your diaphragm for those slow, deep breaths. You would think, well, 15 minutes a day, only 3 times a week, maybe you wouldn't notice a difference. But there was a big, statistically significant difference in those that were doing the diaphragmatic breathing trial. Their mood improved, their anxiety got better, their focus got better, their attention got better, and even their cortisol levels improved. Simple exercise that we can all do. Then there are some herbs that have also been shown to be beneficial. This is one that we will use particularly if you're lacking in focus, or it's also been shown to be helpful for ADHD. It's one of the best studied nootropic herbs available, and it's been the subject of numerous positive human clinical trials, majority of which are randomized, double-blind, and placebo-controlled. There's 500 articles now about Bacopa in the peer-reviewed literature. And it's been shown to improve memory acquisition and retention among middle-aged and senior adults, improves delayed recall memory and reaction times among seniors, improves spatial working memory accuracy in healthy volunteers, improves verbal memory, increases learning rate and information processing speed among healthy adults age 18 to 60, and it improves mental control, logical memory, and learning in people with age-associated memory impairment. But in addition, there have been a number of studies done on 4 to 18-year-olds with ADHD. And it's been shown to help manage symptoms of ADHD in children, enhancing self-control and attention while reducing restlessness. ADHD people tend to be rather impulsive, very distractible, not necessarily high in self-control. But Bacopa helped with that. It boosts learning and memory in children requiring an individual education plan, 93% improvement in restlessness, 89% improvement in self-control, 78% improved learning problems, 52% improved psychiatric problems, 26% logical verbal memory, 23% improvement in working memory and short-term verbal memory, and 17% improvement in visual memory. And so this is so important that, and so effective that we actually formulated this. We have it's very important to get all of the different molecules. There's actually 9 different molecules that are having a positive effect in Bacopa, but you want to make sure it's grown right. It's primarily grown in eastern India and Bangladesh, and you want to make sure that it is handled appropriately as well after it is harvested and not allowed to dry or get fungus on it. And so we have formulated with a company that has that type of quality control. In addition, we put it with 2 other agents that have been shown to be very helpful from the skin of grapes and the skin of blueberries. We talked about blueberries being an important antioxidant. Blueberries actually have been shown, Harvard University showed this in particular, that if you're just eating 1 bowl of blueberries per week, you significantly reduce your risk of ever developing dementia or Alzheimer's disease. And so for those with age-related cognitive decline, in fact, I should give you a little more detail about that. And, perhaps in a medical audience, I would normally say how this study is done, but I think you can still get the idea. But there were individuals, for instance, that died from an auto accident that they did an autopsy on, and they found out that if they had eaten blueberries within 60 to 90 minutes of that auto accident, when they got into the brain, the memory portions of the brain, they saw this blue hue of the blueberry pigment actually going to protect that temporal lobe of the brain. And so there's a particular set of molecules in blueberries that have been shown to be helpful. We put that with the Bacopa on top of it. And people will notice in that that are taking, we put it in a formula called Focus. And with Focus, 2/3 of people will notice a marked improvement in their focus within 90 minutes of taking it. So this is far better than taking Adderall or these drugs that you're going to have a hook on. ADHD drugs are being handed out greatly, but they have short-term gain and long-term problems. But this doesn't have any long-term problems, and it can even have the short-term gain within 90 minutes. Plus, when you combine these 2 together with L-tyrosine, last time we talked about L-tyrosine, there's a type of L-tyrosine that crosses the blood-brain barrier better called N-acetyl L-tyrosine. When we combine that with that, there are studies showing for those that have already started to suffer from age-related cognitive decline, that their memory, after 6 months of taking it continually, their memory will go back to what it was 10 years earlier. And so that is, of course, far better than even the leading drugs for Alzheimer's. Another agent that's been shown to be very helpful, particularly for depression and anxiety, is saffron. It's the most expensive spice sold. 50,000 flowers, enough flowers to fill a football field, will be needed to produce a single pound of spice. And saffron, 30 milligrams daily, has been shown equivalent to Prozac or fluoxetine for depression. And in 6 weeks, significantly improving the depression scales, but no sexual side effects with saffron. You do get the sexual side effects with the SSRIs. It also has been shown to improve premenstrual syndrome. Even smelling it helps, but taking it orally as well helps. There have been 7 now randomized controlled trials of saffron. It was comparable efficacy to traditional antidepressants, but once again, without any reports of serious adverse events. Saffron was shown to be as effective as fluoxetine in the treatment of major depression upon review of 8 randomized controlled trials, and takes about 4 to 6 weeks for its maximum effect. Another expensive supplement called S-adenosylmethionine, we talked about that last night in producing methylation. It improves, SAMe will not only improve depression, but improve the sexual function. No weight gain with it like you get with SSRIs. No tolerance develops, and it also helps with memory. It's been shown to improve osteoarthritis, even fibromyalgia and Parkinson's disease because of the increased dopamine output. L-tyrosine also can improve Parkinson's disease. Of course, we're treating some advanced and severe cases of depression. And since SAMe is expensive and saffron also is expensive, you never see those 2 used together. But we've shown that when they are used together, we can have a nice positive effect. And so we formulated this again ourselves so that it could be less expensive. So we have a formulation where it's less expensive than SAMe or saffron alone, but you get both combined to produce that positive effect that will indeed have a superior effect to your typical antidepressants. Light is also helpful. Bright light is an effective antidepressant. It gives results equivalent to SSRIs for non-seasonal depression and works best for those who have fatigue with their depression or have a tendency to either eat too much or sleep too much. Too much sleeping actually is one of the symptoms of depression. If you look at your 9-item aspect of things, they're asking you, are you sleeping too much? By the way, what is sleeping too much if you're an adult? More than 9 hours. So anything more than 9 hours in a 24-hour period is going to be hypersomnia. It's actually not good for the brain to be sleeping that much. And the bright light can help you with a lot more energy so that you're not wanting to sleep all the time. It also works for partum and postpartum depression, and it works also for bipolar depression. It's one of the best things that can get people out of the depression phase of bipolar disorder, and it gives results much more quickly than medication does, but of course it can be used with or without medication. So we do recommend, particularly in the wintertime, light boxes to be able to, medical grade light boxes to be able to get the amount of lux. 2,500 lux for 2 hours in the morning will be necessary to produce an antidepressant effect. If it's a brighter light, 5,000 lux for 1 hour, or 10,000 lux for 30 minutes. Now this has to do with the white light. And one of the reasons why it needs to be so bright is we have found out it's not the white that's necessarily benefiting you. White is all of the spectrums of light. It's the blue portion of the light. And so we have now teamed up with a company that just emits the blue portion. It doesn't have to be near as bright. It can be a softer blue and produce that same positive effect. And since people are busy in the morning, we actually utilized this light on a wearable. It actually looks like glasses. People will think, oh, all right, so she came in just in time. Katie's going to have me demonstrate this. I don't know if they have it charged up or not. Yes, you can see the blue there. If you can, so you can walk around, do your work. It's going through the rods of your eyes, and it's actually increasing your serotonin level and also setting your body clock if you do this first in the morning. If you turn the lights out, your kids will think you're really cool walking around with this. And they're very effective. Yes, and in fact, we'll show you some of the studies on this. If you're using a light box such as what she's using, a medical grade white light box, you want to have it 18 inches away and offset about 20 to 45 degrees. But the blue light, notice 100 to 1,000 lux is equivalent to 10,000 lux of white light. And you don't have the complications of the brightness when you're just using a blue light like that. I'll take some questions after the presentation here tonight. Research on... They're available out on the desk, thank you. Researchers found that men who were exposed to an hour of bright light first thing in the morning experienced an increase in luteinizing hormone. Once again, this is going to be your blue light portion or a bright white light. Luteinizing hormone is made by the brain's pituitary gland. LH influences reproductive hormones in both men and women. Increases in LH in men drive up what? Testosterone levels, while the hormone triggers ovulation in women. Studies have shown that LH also helps with depression. Luteinizing hormone does. It improves libido, and you will also get a muscle building and strengthening effect. There's a lot of men out there, I don't know how it is in Australia, but in America it's a big racket in advertising on TV for men to check their testosterone levels. And the idea is if you're low in testosterone, you see this doctor, pay thousands of dollars to get testosterone implanted in you, or to get shots, or to get all of those sorts of things. Of course, they don't tell the men that their testicles will atrophy, because if you're getting shots, your testicles don't need to make it anymore, and so they'll just shrink right down, et cetera. And then you're kind of dependent on this testosterone for life. And these men are not told that if you would just get bright light in the morning, you know, go outside, get some bright light, or get a medical grade light box. Their testosterone levels, we've noticed, double within just a few weeks of getting that luteinizing hormone up there. And then there's other things that you can do naturally as well that we might talk about in the next hour when we talk about intimacy. When women with long and irregular menstrual cycles are exposed to bright light, the cycles actually regularize as well. So women with irregular periods, et cetera, can be helped a lot by getting that luteinizing hormone from bright light. As mentioned, the average American spends over 90% of the time indoors, and one of the issues with being indoors is you also do not get infrared light. Now, this is new and exciting research. For years, we have known that bright light from the sun, when it's direct enough, and by the way, this time of year, it's hard to get it direct enough. I was out there in the Sydney Harbor today, and I looked at my watch. It was 12:15, and I was looking at my shadow, and my shadow was as long as I was. In order for you to get vitamin D from the sun, ultraviolet, it needs to be shorter than you are. Now, if it's long enough, if it's as long as you are, you're still getting a little bit of vitamin D, but you want to have that sun direct enough to get vitamin D through the skin. Now, in the summertime here in Australia, it's no problem to have that shadow much shorter than you are, and you're going to get plenty of vitamin D. And hopefully you have stored enough so that in the wintertime, when even at high noon, the shadow is longer than you are, you're not getting any vitamin D in the wintertime. But it's a storable vitamin. That's why it's a fat-soluble vitamin, to store it so it'll hopefully last in the wintertime. But if you're not out in the sun, even in the summertime much, chances are you're going to need vitamin D supplements because you're not going to be able to get near enough from the sun. And we used to think that vitamin D, in fact, the study showed that when your vitamin D level is up from the sun and it's nice and high, it protects you from a number of diseases. It's the #1 cancer protective hormone, and it also helps your immune system. It can help you overcome viral infections. It also helps depression and anxiety. It helps bone strength. I mean, the list goes on and on. It even helps depression, anxiety, and overall energy levels. But when we saw people with low vitamin D levels and we gave them vitamin D supplements, we saw some benefit, but not near as much benefit as getting the vitamin D level up from the sun. What does that tell us? It tells us that it's not just vitamin D helping us. There's something else about the sun that is helping, independent from vitamin D. Well, now we know what that is. For years, there was a question: why does vitamin D in supplements not do what vitamin D does from the sun? And the answer is infrared light. Ultraviolet is what produces vitamin D. Infrared penetrates your clothes. It even penetrates your skull. It can go down about 3 to 4 centimeters in that skull. And when infrared light gets into your system, it produces some significant benefits, particularly in the mitochondria of your cells. Near-infrared portion of natural sunlight stimulates an excess of antioxidants in each of our healthy cells. The cumulative effect of this antioxidant reservoir enhances the body's ability to rapidly deal with changing conditions throughout the day. Now, we know melatonin is also a potent antioxidant. That is what is made by your pineal gland at dark. It's called the hormone of darkness. It circulates through the system. We can actually measure it in the bloodstream. But intracellular melatonin comes about as a result of this near-infrared light. And intracellular, it doesn't get outside in the bloodstream. You can't measure it, but you could measure it actually in the cell. And infrared light is producing that melatonin to protect your mitochondria from burning out. The mitochondria, the energy-producing cells in your body, that's where all of your ATP is made that we talked about in making these neurotransmitters, et cetera. And you can get infrared light all the way from sun up to sundown. Half of the photons, when you go outside, you can't see. Now, you can't see the ultraviolet portion. You can see all the visual spectrum, but half of the photons are in the infrared portion that you can't see. And it's the near infrared that is producing all of that benefit. And the gentleman that I talked to you about the other day, who's 100 years old and just doing great, he was very particular about spending a large amount of time outdoors every day, several hours, working in his garden, doing all of those things. He started to do that from his 50s all the way up to where he's at now at 100. And now that the research has come out, all of that near-infrared has protected his brain. By the way, the gray matter in your brain, you've heard of gray matter and white matter. What makes the gray matter gray? It's the mitochondria. And the mitochondria is in the periphery of the brain. And that's where the infrared can actually intersect with, is those mitochondria to protect those mitochondria from burning out. So the benefits of near-infrared therapy. This is not your infrared sauna. Infrared saunas are far infrared. That's going to heat you up. Near-infrared is between 700 nanometers to 2,500 nanometers. And it's been shown to boost metabolism, prevent mitochondria from burning out, increases energy, cognitive performance enhancement, post-traumatic brain injury, reduces PTSD symptoms, reduces inflammation within the body, and can even be a potent pain reliever. So I wanted to stay on time today, and you will be able to learn more about these things when and if you go through the community program that Katie is hosting. But I might have time for about 2 questions, and then we'll have a 10-minute break. Any questions about what I've presented here tonight so far? Yes?
I can take up 2 of your questions, but the first major question is about sunlight, and they talk about if you have too much sunlight exposure, you will develop cancer. Can you answer what would be the best time spent in the sunlight rather than getting too much excess, and then what's the excess in vitamin D?
Yes. So what about excess sun exposure? You can get excess sun exposure if it is direct sun. In other words, if your shadow is shorter than you are, you need to limit your time in that ultraviolet light. And depending on the time of year, you might only, and how light your skin is. If your skin is very light, you're going to be susceptible to a sunburn, and after 20 minutes, you're probably going to want to either get out of the sun or put on a potent sunscreen to prevent you from getting the sunburn. However, outside of the sunburn itself, it's not a dangerous thing. And we want to avoid the sunburn because it can cause melanoma, which is a pretty malignant skin cancer. Can cause other skin cancers as well. But overall, studies are very clear. Sunlight actually protects you from more cancers than it causes. And this whole idea that people need to stay out of the sun, a decade or 2 ago, we had dermatologists out there telling everybody to avoid sun exposure at all costs because they were just looking at melanoma and maybe, skin wrinkling or things like that. And they weren't looking at the other adverse effects of not getting enough sun exposure. But sun exposure actually helps prevent far more diseases than what it causes, but we still want to avoid the sunburn. Now, if the shadow is longer than you are, you can be out there without any sunscreen and not have to worry about that. There's a lot of people who put sunscreen on from sun up to sundown. You don't need to do that. You're not going to be burning. Infrared has no known adverse effects on the skin. I'll take one more and then we'll break.
It sits on the skin, from what I understood, and it takes up to 24 hours to convert from D2 to go into the skin and convert into D3. And therefore, if we shower, or it's fat soluble, so if we use soap, are we going to destroy the D2 that's on our skin that's being processed into D3?
Yeah, that's a great question, and he's right. You make D2 under the skin. It has to circulate through the kidneys to be the active hormone, vitamin D3. So if you don't have good kidney function, you actually need to take D3 supplements because your kidneys won't be able to convert it over. But D2 is actually what is stored. And there have been studies how we began to figure this out. In Hawaii, where there's a lot of direct sun, we thought the surfers would be having very high vitamin D levels, and they weren't. These Hawaii surfers were deficient, many of them, in vitamin D. It wasn't because their skin wasn't making it, but with all that ocean water going past them, it was actually washing all of that vitamin D that they were making because it's made just under the skin. So if you're perspiring a lot in the sun, you will also lose a lot of that vitamin D. So it's actually best to be out when you're out in direct sun, to just be enjoying it, not perspiring, not out there, in the ocean, having it washed off and those sorts of things. But you don't have to wait 24 hours. So that's taking it too far. But you probably should wait several hours. All right, well, you've been a very attentive group, and we look forward to seeing you at our next presentation in a few minutes. Get some water.